If you've had a caesarean with your previous birth, there is a very good chance that you'll have a vaginal birth next time. We call this VBAC, vaginal birth after caesarean. Caesarean sections increase your chance of bladder damage, infections and other surgical risks, as well as increasing the risks for future pregnancies. If you choose to have a caesarean section, then your recovery time will be longer compared to a vaginal birth. Babies tend to struggle with their breathing after a caesarean section because they need the stresses of labour to help their lungs get ready.
I think the main concern is that it won't work, is that you've still got that unpredictable nature of labour. You don't know necessarily that you're going to be able to deliver the baby. There's so many variables. The first time the variable had been my son's position, so it was nothing that I could change or control. Our immediate thought was to book for a caesarean. But as the pregnancy went on and as we thought about it more, we came to realise that the risks we were trying to avoid actually are less with a normal delivery. And so we decided to try for a vaginal birth after caesarean, and it all worked out beautifully.
It was really important that we went for something that my wife felt comfortable with and was her preference. And so ultimately that's why we ended up going for a vaginal birth, something I would never regret and I would definitely push for again in the future, because it was just a really, when everything went smoothly, it's such a positive experience for both parties in that respect.
Your chances of having a successful VBAC are increased if you've had a previous vaginal delivery, if you're fit and of a healthy weight, and if your labour starts spontaneously rather than being induced. If you're not already pregnant, we do recommend that you wait for 12 months before getting pregnant to allow the scar on your womb to heal properly. Speak to your doctor and your midwife about the risks because it differs from person to person. For example, if you had a caesarean section because your baby was in the breech position, then you are very likely to go on to have a successful VBAC. But overall, the success rate is around 73%, which is about the same as having a vaginal birth with a first delivery. In Gloucestershire, we recommend you come to our consultant-led delivery suite to have your baby if you're having a VBAC, and this is so that you can be appropriately monitored and would have an early warning should anything go wrong. You will have one-to-one care with a midwife, just as you would if you were on our birth unit or at home, but you will be closer to our theatres should your baby be in distress at any time.
Gloucester has availability of a low-risk pool room on their unit. That's where I decided I felt safest to deliver.
A lot of women say that their main concern is that their scar will open during labour. This is called a scar rupture. This is quite rare. It happens in about 0.5% or 1 in 200 cases. And in some of these cases, it's just a small opening of the scar. But the safest way to deliver your baby in any of these cases is to go to theatre for an immediate caesarean section. You may have heard it said in the past that once a caesarean, always a caesarean, and this used to be true, but so much progress has been made that generally a caesarean scar heals very well and it is safe to go forward to have a vaginal delivery next time. If you are planning a VBAC but need to be induced, then speak to your consultant because the risks of scar rupture increase slightly with some of the medications we use for induction, but there are alternatives which may be appropriate for you. If you've had a scar rupture or more than 2 caesareans, we recommend that you don't have a VBAC but go for an elective caesarean section. But speak to your consultant who can explain everything more clearly.
It was more just the unpredictable nature of delivery that I was concerned about rather than there being an issue with the scar. I hadn't had any issues in my post-op with the scar. I had no tenderness, no pain, no bleeding in my pregnancy, nothing to say there would be a problem with the scar. And the risks of scar rupture, I believe, are quite small anyway.
We recommend that you are continuously monitored in your labour, but all of our machines are wireless, which means you can be fully mobile in labour. You can even get into our birthing pool. Being active and being relaxed really does help your chances of having a vaginal birth.
Yeah, to have my wife up and walking about so soon after, it's fantastic. Again, because you're healthier for her. She looks healthier. She looks happier for doing that, and that's fantastic.
Trust your healthcare professionals. If that's what you want to do, tell them, and they'll support you if they can. And if it's not safe, they'll inform you otherwise, so that you can make a proper plan and make a decision.
Women who have had a previous caesarean section will have a lot of questions and anxieties about the birth of their next baby. It is not an easy decision, and you should make the decision that you feel is right for you and your family.
Nothing was too much trouble for them. They were always there to answer any questions or to help you out, no matter how silly a question that I could ask. Yeah, they were brilliant, absolutely superb.